Hello everyone, I am Dr. Mayur, faculty for endocrinology at Marrow Super Specialty, and today we have very important guest with us. We have candidate of the year or the doctor of the year, Dr. Ayushi, who has cracked the toughest exam, INISS, and she's ranked 2. So congratulations from my side and team Marrow. So really, you did a great job, and this was the toughest exam and probably the last exam of your life. So in that sense, the theoretical part. So how are you feeling now?
Thank you so much, sir, for such a great introduction. And, sir, it feels surreal. Like I keep checking my result daily. That have I not seen something wrong, and I match it daily with my roll number, sir.
Okay. So were you expecting this result?
No, sir. I was like, okay, something. I will get something, but I don't know if I'll get into Delhi or I'll be in the top three.
Okay. So just tell me about you, where you did your MBBS and your MD.
Sir, I did my undergraduation and post graduation from UCMS Delhi. And sir, I passed my MD medicine in February 2025.
Okay, so this was your first attempt.
Yes, sir.
Okay. So like we are seeing in past 2, 3 years, every alternate candidate is actually going for endocrinology. So was it that everybody is taking endocrinology? That is why I'll also go for it, or any special preference, or why did you choose actually endocrinology?
Yes, sir. Sir, initially I was very confused with the branch of choice. I used to, like, whenever I used to decide about a specialty, I used to read in lens about it. Doesn't seem the right approach, but like first I wanted to take up neurology. I read up whole of neurology, and then I said no, I don't think it is for me. Then I read up endocrinology, and then even like the topics which I haven't seen, I was not exposed to, that topics also interested me. And sir, in UCMS we have an endocrinology department as well. So the seniors there were very helpful, and they used to teach whenever they used to come up in the emergency, they used to guide us. So all of this, and since it is so closely related to medicine, so I decided to take up endocrinology, sir.
Okay. So probably it was the interest which developed during the rounds and during your posting in endocrinology, which said that, okay, let me go for this. So do you think that it is really important to work in endocrinology department to get through this exam?
No, sir, because like if the exposure is there, it is very good. But even if like we attend the lectures and if we read up, then also we'll get the hang of the subject. So it's not like if you don't have the exposure, you cannot opt for it.
Okay. And what do you think that those candidates who are preparing, because there's a big confusion between the INI and the NEET SS because the pattern is different, right? So many of the aspirants are really confused that what should I do? Whether I just focus on the basic medicine and more of endocrinology from the Harrison, or should I go for the Williams, or should I read the D route as well, at least the important topic? So what was your approach on this?
Sir, like in during my residency days, so I really loved reading medicine. So whatever case I used to see, I used to go back and read. And like even if some important cases used to come, then I used to read their specialty portion as well. Like if I'm not able to understand the treatment portion, so getting strong in medicine is extremely important. And once in the residency years, I would say 2.5 years you like dedicate on reading medicine, and if then you want to take up the specialty subject, then you like read specifically for it, but you cannot like leave medicine and just focus on one subject. So reading medicine as a whole is extremely important, be it the
So,
clinical part.
yeah. So, what do you feel that how much time is required actually to read and go through this super specialty, especially endocrinology, if I talk about?
Sir, I started because I decided late, like in July first week. Then in 6 months I had my exams also. So I thought that I'll do side by side. So 7 days, for 2 to 3 days a week, I used to read up endocrinology, and last 5 days I used to go for clinical and general medicine. So if you are reading on a whole, then 2 to 3 months would suffice. But since I was doing my residency, so it took me 6 months to complete the medicine part as well as the endocrinology part.
Yeah, so most of those candidates who got selected thought that 6 months is at least what is needed, and it's time is this time is good enough to prepare. So obviously you would be going for the AIMS Delhi, but for others, what do you think that whether going for DM is really important or DNB endocrinology is good enough? Like, was it in your mind that if I don't go through this, I don't clear the exam? Then DNB is endocrinology, because not a typical branch where you need intervention. One patient can teach 10 candidates, right? So that's the difference between endocrinology and cardiology. So what do you think that whether DNB is good enough? Because many of the candidates have this dilemma that whether I should retry for DM, or now I'm getting DNB, should I go through that?
Yes, sir. Sir, I think it is a personal choice. Like from the very beginning, I was like, I have to do DM endocrinology, and like I, I very much wanted to get into AIMS Delhi. So, sir, I think it's personal choice, and if and DNB is definitely it's worthy enough. Then if you are getting a seat in good DNB college, then I think it's cool.
Yeah, so probably you had very firm determination that you wanted this and you got that.
Probably, sir.
Yes. So just tell me that what was your strategy for this exam, and what did you think that whether the paper was really tough, more of clinical, more of lengthy question? How was the this year exam?
Sir, I felt it to be easier, but sometimes, like in the last few years, some were like straight one-liners, and only some questions were clinical STEM based. Here it was moderate to easy, that you have to think about it a bit, but it's not very not very rocket science that you'll not be able to crack it. So if you have read the subject, you have done the question bank, then you'll be able to solve it in one go. Like, it was okay, sir.
Yeah. What about like previous year, whether solving those questions helped you in this exam?
Yes, sir. Sir, I saw all your previous year discussions twice. Like first, I watched it and made notes, and even 10 days before the exam, I watched your recall twice, because you always tell this is important around this. Next time, this can be asked. So like it is a must to do session. And even sir, your MCQ discussions, sir, some questions like they were exact handpicked from your MCQ discussion. Like one question was there from primary hyperaldosteronism approach, and you had very beautifully mentioned how to go about it, and I didn't have to think even twice before marking the answer. So it's a must do, sir.
Okay, so do you think that these videos helped you, and how was your approach? Whether seeing video first and then going to theory part, or first reading the theory, then watching the Marrow video? What do you think would you have done, and what should be the right approach?
Yes, sir, I watched the videos, made my notes, and then sir, I completed the question. With the question bank, sir, retrograde, what I felt was important, I read Williams. Because I was in my final year, I did not have the time to read cover to cover, but still, whatever was there in the question bank, I used to go back and read those tables and those lines wherever they were handpicked from, even for the GTs. So that gave me a sense that, okay, I know Williams a bit. And sir, I gave then all the tests. Like in the last month, every alternate day, I was giving tests, and specifically the tests of marrow, they are very conceptual. So even I used to don't like I could not get very high marks, but it was like, okay, I know this subject now, I know the concept now, so that was extremely helpful, sir.
Okay, and for the last minute revision, other than your notes, did you read anything, or do you think that if I would have done this, then I would be more confident, or I would even score better than this?
Sir, I read the previous year discussion. I just like even outside the exam hall, sir, I took your previous year discussion copy, and before entering, I flipped to the last 3 years discussion questions, and sir, it really helped. Like some questions were directly from that discussion only, sir.
Okay, and we have created one high yield videos for the last minute revision. So did you go through that, and whether this was helpful or it was of not much use to you?
Sir, like in the last month of preparation, when I used to read my notes and do the question bank, so after 7 days of reading that particular topic, I used to see your MCQ discussion video. So that used to like revise the whole topic which I had read 1 week back. So I saw, sir, all of your MCQ discussion videos.
Okay. And what do you think? Obviously, you have said the good thing, but we would require a negative feedback as well. That what do you think that we could have done better for the candidates?
Sir, I don't know how to answer this, sir. Maybe some number of questions could be increased, sir. Because they're really nice, and we always feel that oh, if some questions more would have been there, then it would be better because the quality is really nice.
Okay. And one last final question. Any message for the future endocrinologist, because now you are on this side of the table?
Sir, I'll just say, there is a quote in Bhagavad Gita. I used to read it. कि कर्मणे वाधिकारस्ते मा फलेषु कदाचना, which means you can only have अधिकार on your कर्म. अगर आप कर्म कर सकते हो तो आपको फल का अधिकार नहीं है. सिर्फ आप only trust the process, only think that what work you have to do, and the result will come automatically, sir. So I just ask that do not think much. If you want something, just work for it and God will give you.
Yeah, so very well said. And I think your firm determination and hard work is what led you to rank two. And that's most important thing, that you should have a positive mind, you should study, and you should do what you can do. Just don't think about the consequences. So totally agree on that. So thank you very much, and thank you everybody who has logged in and is viewing this video. I again congratulate Dr. Ayushi for this wonderful achievement. Thank
Thank you.
you.
Thank you so much, sir.